Hey guys, in this video, we're going to uncover the hidden connections between U.S. health insurance and its impact on your role as a medical social worker, equipping you with the health insurance knowledge you didn't learn in social work school. My name is Tabby, and I'm an LCSW with over 13 years of social work experience in the healthcare field, and I'm here to bridge the gap between what you learn in social work school and real-world experience. I'm going to be breaking down the most frequent U.S. health insurance programs that medical social workers deal with and how they affect discharge planning. Health insurance has a direct impact on discharge planning. That's because in the U.S., health insurance dictates the who, what, and where of healthcare services. As a medical social worker, your primary role is to connect patients to resources and coordinate care for successful recovery. So understanding health insurance is vital to your role. The most frequent types of health insurance programs that medical social workers may encounter include Medicare, Medicaid, and private health insurance. On a less frequent occasion, medical social workers may also see TRICARE, VA benefits, or workers' comp. But for simplicity, we're going to just focus on Medicare, Medicaid, and private health insurance. We're first going to talk about Medicare, but before we dive in, make sure to take a moment to like and subscribe to this YouTube channel. Medicare is a federally funded and ran health insurance program for U.S. citizens and permanent residents who are age 65 or older. It's also for younger people with a qualifying disability or those who have end-stage renal disease or ALS. As a U.S. citizen, once you turn 65, you're automatically enrolled in Medicare as long as you or your spouse paid Medicare taxes for at least 10 years. Medicare has several parts to it. Think of Medicare as like an umbrella. And under this umbrella, we have Medicare Part A, Part B, Part C, and Part D. And each of these parts provide different health coverage. It's kind of like an a la carte health plan. Medicare Part A covers inpatient services and care, such as inpatient hospital stay, skilled nursing facility, home health care, and even hospice care. Medicare Part B covers outpatient services. So that includes any kind of outpatient care, doctor visits, medical supplies, or preventative services. And Medicare Part D covers prescriptions. There are also additional Medicare parts that help cover the gaps between coverage with Medicare Part A, B, and D. These are known as Medicare supplement plans or Medigap plans. You might also see them as Medicare Part F, Medicare Part G, all the way through the letter N. But what about Medicare Part C? Well, Medicare Part C is also known as a Medicare Advantage plan. An Advantage plan takes Medicare Parts A, B, and D and rolls them into a bundle plan. Medicare Advantage plans are provided by private health insurance companies who agree to follow the rules and guidelines of Medicare to provide services to patients. Medicare that has just Parts A, B, and D, that's kind of like an a la carte plan, is what's called Original Medicare. And then Medicare Advantage plans are Medicare Advantage plans. It's important to understand how Original Medicare and Medicare Advantage plans work because it affects the patient's cost of care and your discharge plans. The patients and families that you work with are often going to have questions about what's covered and their out-of-pocket expenses. If you have a patient that needs a skilled nursing facility and they have Medicare, it's important to know that Medicare will pay 100% of the cost for a skilled nursing facility rehab for the first 20 days. For days 21 through 100, Medicare pays 80%, leaving the patient with a 20% copay, which is also about $200 per day based on the 2023 CMS guidelines. If a patient has a supplemental health insurance plan, that health insurance plan may pick up that copay. If a patient is needing more than 100 days of rehab services, Medicare is not going to cover those costs at all, so all of it will be out of pocket for that patient. For patients who are going home with home healthcare services, Medicare will pay 100% of the costs, leaving the patient with a $0 copay for the entire service. So that includes nursing, physical therapy, occupational therapy, and sometimes speech therapy. Under Medicare Part B, which covers the outpatient services, there is a monthly premium cost to the patient. For 2023, that minimum premium is $164.90, and it changes year by year. The patient will also have a deductible, which is about $226. After the deductible is met, Medicare Part B then covers 20% of the expenses. Not all patients who have Medicare are going to have Medicare Part B. Medicare Part B is signed up separately from Medicare Part A, whereas Medicare Part A is something that you're automatically enrolled in when you turn age 65. So understanding the cost of Medicare Part B and making sure that patient has it will help you to determine what the patient's cost of care is going to be, especially if they're going home with any kind of medical supplies or services. And as I mentioned before, Medicare Part D covers prescriptions. Now, under original Medicare, Medicare Part D is a completely different plan that needs to be purchased by a patient. Whereas in an Advantage plan, that's something that goes with that entire plan. Medicare Part D is also purchased through private insurance companies. Because Medicare Part D is purchased through private health insurance companies, there may be some medications that patients get prescribed that may require a prior authorization. And remember, with Medicare Part C, which is the Medicare Advantage plan, that part Medicare A, Medicare B, and Medicare D all are enrolled into one specific plan. Let's talk about original Medicare versus Medicare Advantage plans. As I mentioned before, Medicare Advantage plans are purchased through private health insurance companies. Some of the main private health insurance companies that will offer Medicare Advantage plans include Blue Cross Blue Shields, Humana, Cigna, Highmark, United Healthcare, and Kaiser Permanente, to name a few. It also is going to depend on what state you live in. There might be some other ones there. Okay, let's take a look at some of the main differences between original Medicare and the Medicare Advantage plan. With original Medicare, patients can go to any doctor, hospital, skilled nursing facility, or use any home health agency they want within the United States. However, with a Medicare Advantage plan, patients can only use doctors, hospitals, rehab facilities, or use any home health agencies that are in network with their particular plan. With original Medicare, no pre-approval or pre-authorization is needed for a patient to go to a skilled nursing facility or a rehab facility. However, with Medicare Advantage plans, pre-authorization or pre-approval by that health insurance company is required in order for a patient to go to a rehab facility. Now, with original Medicare, Medicare has what's called a 3-midnight rule. So Medicare says that a patient must have an inpatient stay for at least 3 midnights before they qualify to go to a skilled nursing facility. On the other hand, kind of the advantage with a Medicare Advantage plan is that that is not required. So a patient can go directly to a skilled nursing facility or rehab without an inpatient stay. Original Medicare does not provide any coverage for eye exams, dental services, or hearing services. Those would have to be purchased separately with a Medicare supplement plan that might offer them. On the other hand, the Medicare Advantage plans, a lot of them do offer that service. They'll offer eye exams, dental services, or hearing services as part of that bundle. Also, with original Medicare, a prescription or Part D plan has to be purchased separately through a private health insurance company that offers them. Whereas with a Medicare Advantage plan, that prescription plan is already included in that bundle. Additionally, with a Medicare Advantage plan, there's no need to purchase a Medigap plan, and you can only purchase a Medigap plan if you have original Medicare. Now that you are thoroughly confused with Medicare, let's go ahead and dive into Medicaid. Medicare and Medicaid are often confused because they sound very similar. However, Medicaid is a federally and state-funded health insurance program that is actually run by the state. This means that Medicaid is going to vary state by state as long as they meet the minimum federal requirements. Medicaid is for people who meet their state's low income threshold, and this can include anybody who is 65 or older, people with disabilities, families, children, anybody who meets that state's requirement or low income threshold. Medicaid can provide coverage for prescriptions, co-pays from insurance, hospitalization, surgeries. It can provide skilled nursing facility care or rehab, home health care services, hospice. But the biggest thing that it provides and what makes it so different from Medicare, besides the low income, is the fact that it actually pays for long-term care or nursing home placement. It also provides what's called a home care-based services program, which provides a caregiver that can go into the home of the patient for up to 40 hours a week to help that person with activities of daily living. The point of that program is to help people stay in their home for as long as possible. Because Medicaid varies state by state, I highly recommend that you go to your state's website and find out what Medicaid services are provided and what the qualifications are. Lastly, we have private health insurance. This is also known as commercial health insurance. This is insurance that is either provided by your employer or purchased privately through the marketplace. These health insurance plans are going to vary in coverage. If a patient has a private health insurance plan, I often encourage them to contact their health insurance provider and find out what their coverage is and what their policy says. I also encourage them to see if they can get a list of in-network skilled nursing facilities or home health care agencies in case that is what's needed in their discharge plan. Most private health insurance plans are going to cover the same things like Medicare. It's going to probably cover the inpatient hospitalizations, prescriptions, home health, skilled nursing rehab, etc. They might just require an authorization or a prior authorization before the patient can receive that service. And they will often have to choose care that is in network with their particular plan. All right, there you have it with Health Insurance 101. I hope that you found this helpful. If you have any questions, please feel free to email me or leave them in the comments below. I appreciate your guys' comments and ideas of future videos. Also, make sure that you like and subscribe to this YouTube channel. And also check out the Medical Social Work Mastery newsletter, and you can sign up for that in the description box below. All right, see you next time.